do you get through to women sometimes? It's the toughest thing to get through to people with regard to their health and tell them you've got to know it, you've got to understand it, you've got to realize it. How do you get through to them to make them understand that you may have heart disease and you've got to keep up on it? You got to check it.
Well, first of all, I think one of the most important aspects about our organization and my friends who are women heart champions is that we've been there. We walk the walk, we talk the talk. There's a certain extra layer of credibility that you get from people who have shared that journey. But risk factor education is fairly cut and dry and not difficult to understand if it's presented properly. There are risk factors we cannot control: our age, our family history. But there are many things we can control. The first thing we can do is never smoke. If we smoke, stop smoking. The number one thing you can do. Be active. Do some exercise. You don't have to be a gold medal winner, but you need to do some type of movement every day.
And you have to understand there's two columns here. First
Yes.
is lifestyle, and one is the other one you were talking about is unchangeable factors here. But let's put lifestyle and make it simple. You can change these. Every single one there is changeable by every well, okay, I'm going to stop myself. Sometimes high cholesterol is there because you've had it in your family. Sometimes diabetes is something which comes along from your family. But most of these are things that you can change or at least help get better.
Oh, absolutely. And you may not change the fact that you had high cholesterol or diabetes when you first found out about it, but treatment can certainly change the fact of whether you continue to have it. You can be diabetic and you can control your diabetes, and sometimes with weight loss and proper medication, you can almost eradicate the problem that you had before.